Ortho, 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 where that book, Contemporary Orthodontics by Prophet, now really matters and comes to light. Stay tuned as we talk to a first year, PGY1 first year ortho resident about how she got into ortho residency. Stay tuned. Hey, it's Dr. Darwin, the new dentist coach, for another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Guys, be sure that you are subscribing and liking and commenting on this content that's been helping a lot of people over the last 6 years. All right, so subscribe, like, share. Sharing is caring as well. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. Right here, GetIntoDentalResidency.com, the ultimate resource to help you match and get selected into your top residency program this cycle. For more details, go down below and check it out, and we can definitely help you through this residency application process. And this is the process that we're going to be talking about today for orthodontics. Today we're joined by Dr. Christina, who's going to tell us all the things about ortho, why she chose ortho as a residency program, how she prepared her application, the number of programs, why she selected those programs, the interview day, and some advice and tips for applicants as well. So let's jump into it, and also make sure that you're staying all the way through until the entire length of the episode, so that you don't miss some of the good nuggets that Dr. Christina is going to be sharing with us. So let's get started. Let's brush it up. Doc, how you doing?
Good. Thank you, Dr. Darwin, for having me. I'm happy to be here and share a little bit more about my experience. It's perfect.
Awesome. Well, it's been a while. I know we've been trying to link up since dental school and finishing school, and then moving to New York, and then
trying to make it work, trying to make it happen. Yeah.
So please introduce and also tell a little bit more about yourself for people who are meeting you for the first time.
Yeah, thank you. My name is Dr. Christina Aponte. I am originally from Rochester, New York. Went to college in Buffalo. Went to dental school at Meharry Medical College over in Nashville, Tennessee. And like Dr. Darwin was saying, I'm a PGY1 at Bronx Care for orthodontics. And yeah, new to New York City, and it has its own host of the ups and downs, and especially with July 4th was right around the corner, so everyone was shooting off fireworks for like 2 weeks. So it's been hectic trying to settle in, but we're making it work. Yeah.
Absolutely. Yeah. Welcome to the other part, the other New York.
Right. Two different New Yorks. So it's been fun. It's been fun finding our little places here, but. Yeah, I'm happy to share a little bit more about my journey and why orthodontics and where we are today.
Why ortho? Why ortho for you?
So in dental school, I mean, like many other applicants, I had my own host of personal reasons with orthodontics, and I had gone to the orthodontist, loved it, shadowed there, loved that he was constantly on the go. But when I started dental school, I really wanted to stay away from being so narrow-minded and so stuck to one specialty when I hadn't even seen my own patients. So, your first 2 years, very didactic heavy. But once we got into the clinic, it really became apparent that going towards this pathway of orthodontics, it just made more sense to me. And then also when starting dental school about 6 months prior, I had jaw surgery twice. So had it in the beginning of January, 3 weeks later, we're going to have to go back in. We have to redo a few things. And so that the next months to follow, it was a lot of, gosh, when I look in the mirror, I don't recognize this person anymore. What did why did I get here? How come no one told me this before? Did they tell me when I was little and I just forgot? And all of a sudden here I am with this new face. And there's the oral surgery component and there's the orthodontic component. And for me, it really became clear that pursuing and being part of that team on the orthodontic side was incredibly enticing, and I'd love to offer my support from a personal standpoint to other people that needed the same procedure.
Wow,
So,
that's
yeah.
a great story. That sounds like a research project right there.
And it really leads you down a couple rabbit holes. 2 a.m. You're Googling, oh my gosh, what is this? What is this? And even talking about my own personal case. Why was there a relapse? Why didn't it go correct? Or why didn't it go right? Why didn't it go as planned? And when I would go talk to other faculty on these externships, and when I was shadowing, they're like, "Oh, don't worry, that rarely ever happens." I'm like, "Well, it happened to me,
Right.
So if not me, then who?" So that's really why we're here. And the learning curve is steep,
Yeah.
but we're just day by day.
Yeah. Interesting. Yeah, everyone has their own story as to why a particular specialty. Lots of times for ortho, it is, that fascination of getting braces and the social acceptances, and then in your case also the treatment modalities and how things worked or didn't work, and just piques your interest even more. So cool. Well, before you become a PGY1 ortho resident, you got to apply. So let's talk a little bit about, your process of how you put together your application. It'd be interesting to hear about that as well.
Yeah, so it's pretty clear, when you talk to faculty and when you talk to the program director and upperclassmen, people who have MACs, there are certain components and criteria that they're looking at. You have your GRE score, you have letters of recommendation. Did you go on externships? Did you complete research projects? What does your CV look like? And what does your GPA look like? However, you will meet everybody under the sun that did not meet those criteria. They did not check off those boxes, and they have their own path into orthodontics. So it's frustrating as an applicant because you're willing to do what it takes, but if there's no clear idea of what it takes, it can put you in a difficult spot.
Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters. We can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. But you got to hurry up because residency application is right now. So shoot me an email right now. All right, let's get back to this episode.
So for me, I'm like, okay, first things first, a research project. I wanted to specifically conduct a research project as it pertained to orthodontics, and that could be, airway management. That's a rising subset of orthodontics. Orofacial pain, the same. TMD, the same. And a lot of faculty had some pushback with that, both at my institution and other institutions. You don't need to do an orthodontic project in orthodontics. But again, going back to feeling like I was checking off those boxes, I was very tired of, same thing in applying to dental school. I was tired of doing something just because I thought that I had to do it. I thought, whether this leads me into matching into orthodontics or not, I need to do something that makes me feel fulfilled. And it's very tiring feeling like you're doing things just to impress somebody else. I mean, you have to do a certain number of, you have to reach a higher level by putting in the extra work to impress that admissions committee. But at the same time, you still have to do something that kind of fills your soul. So for me, that's what led me down that road. And I think people can get pretty bogged down if faculty at their institution does not offer a project that piques their interest. But I really wanted to share, why not when you go home for the summer, when you go home for winter break, planning that out, seeing, is there a faculty conducting a project that I could kind of hop in on for 1 month, 3 months, depending on how long that break is. But then also nearby institutions. If it's not a dental school, is there, for example, for us, Vanderbilt. Vanderbilt's right there. They have a whole craniofacial team there. Perhaps I can pop in on a Friday afternoon or whatever the case is. I think you need to be a little bit creative about how you tackle each of those criterion. LinkedIn was a very helpful tool as well, because then you see, oh, there's this orthodontist who he has his practice, but again, on one Friday every month, he goes to Vanderbilt and he works with their craniofacial team. Maybe I shadow him at his office and see if there's some room for me. That was a big thing that helped. I would say one out of 5 times someone would actually respond on LinkedIn. People are busy. Not everybody checks in their LinkedIn, and it's not. Don't be discouraged. There are people who are willing to put in that extra time to help mentor and allow you to shadow. And then when you are looking to see who are you shadowing, how are you spending the little free time that you have, perhaps, so-and-so has this office nearby you or nearby home. You shadow them, you get to know them, they get to know you, and they graduated from an orthodontic program that you're very interested in. Perhaps asking them for that letter of recommendation if, there's a positive relation there and they can write something positive on your behalf. I think that there's so much to look at in an application. And so when an admissions committee is looking through all of who you are, certain things stick out. And if we are University of Michigan and we see somebody who graduated from our school, we're looking at that applicant just a little bit deeper. And so again, talking about letters of recommendation, diversifying that pool. I think that people can get stuck with having letters from just their institution, and that's perfectly fine because those are the people that know you the best. But again, when there's so much to look at and there's so many well-qualified applicants, you're trying your absolute best to stick out. And you're selling yourself short if you forget about so-and-so who you used to work with during undergrad or whatever the case is, that happened to graduate from these programs. So, yeah.
Good points.
Yeah.
Good points. Yeah. I think the one that stuck out for me was the LinkedIn networking, as far as as a source of your application and being able to look for opportunities to connect with people for research, and more information. And then the second one was the diversification of your letters of recommendation, because you may be at an institution that doesn't have ortho.
Yeah.
Right. And so what do you do?
Yeah.
So like you said, being able to know what's in your catchment area, so to speak, but also maybe back home where you're from or your undergrad institution, there may be an opportunity where you can go home and put some really strong components together to really enhance your application so it stands out. So some really great points there as well. So now you've got your application together, but also part of that is getting your list of schools together so that you know where to send your application out to, right? So tell us a little bit about your thought process as to, all right, I'm going to do ortho, started my application. I need to send this application out to people, out to programs. Tell us a little bit about your mindset about how you determine which programs to apply to. Did it have anything to do with current residents that you knew or came from your school? Was it geographical? Was it based on research? Let's explore that as well.
Yeah. So first and foremost, I would say talk to your upperclassmen. The upperclassmen at Harry always say, I'm gonna butcher what they always say. It's like something, quiet mouths never get fed. That's an expression. They say it all the time, and now I'm forgetting it. But it is a
closed
very
mouths.
important.
Closed mouths.
Thank you. I'm like, what is it? I'm like, empty mouths? No. Closed mouths don't get fed. And that they harped on that, and they're right, because they're a wealth of resources. They know so much. They've been through the process. And what I most importantly want to share is just understanding the cost of how much of the application cycle. You'll never know. I mean, gosh, with the COVID pandemic, are they conducting Zoom interviews? Is it in person? And a lot of programs actually stuck with doing the Zoom interview style as well. So you really never know. It's hard to anticipate that part, but at least knowing how much it's going to cost to apply per school. Mm-hmm. So I did not do that. I just applied to 17 schools, and it was probably, let's say, starting to apply May, June. And then right around November, you start looking around like, okay, how am I going to make it home for the holidays? Because we exerted everything. So
right, ortho, or do I go home? Ortho, or do I go home?
Right, very, fair points. And you right around the corner, you have boards and licensure, and so that was a lot of hurdles to jump through there, even working part-time in school. But so 17 schools. But then at a certain point in July, July or August, I had seen on Student Doctor Network that maybe 15, 20 programs had released interviews, and I didn't get any. So I freaked out, and I added 6 schools. So again, the way I perceive the entire application process is you're putting your everything on the line. It is an investment, yes, and I know that every applicant knows that, but you are mentally strained, financially strained, emotionally strained. I remember the first time I sent out my application to one school. It was like one school, you had to mail it in, and it was like the most draining afternoon because you want everything to be perfect, but then from there it kind of just gets easier. But yes, and even on one of my interviews, I think the resident was trying to see how many schools we applied to and kind of get a feel out. But he said, I applied to 20 schools, and if I could go back, even knowing that I got in, that I matched, I would apply to more. That's not how everybody perceives the process, but I'm, again, just sharing my experience. And then as far as which schools I wanted to, which schools I was looking at and why, location was a big thing. Moving to the Southeast was a wonderful experience. I learned so much about myself and about a different area of the country, but I knew that wasn't where I wanted to stay. So at Meharry, a lot of students stayed in the Southeast, so it was difficult to say, well, I kind of have to branch out and see, go places where Meharians haven't always gone. So with that in mind, it was reaching out to upperclassmen. Where else did you apply? Where else did you interview at? Because I want to get a taste of the culture at different programs. So that was very helpful for sure.
Yeah, and that's a good point, that utilizing your resources, most notably the current residents in certain programs that have been or those that have been former grads at your school, or friends at other schools where they're at currently, or where they graduated from. There's also a great resource, and it helps to fill in the gaps. There's a lot of gaps sometimes in getting information about programs, and being able to speak to current residents or recent completers of the program really helps you to develop or narrow down your list of schools and programs. Now, you mentioned interviews, which is a great segue, because again, there's in person, and then there's virtual, and programs will continue to do a little bit of both this upcoming cycle. Tell us a little bit more about your interview days, what they were like, and if you had any questions that maybe were unique, or that you were like, hey, wait a minute, I didn't think they're going to ask me that one.
Yeah, of course. So there was one particular program where they really wanted to get a good feel of who you were on a deeper level, and the questions kind of varied between, what qualities do you think you have from your parents, or what did you want to be if you weren't a dentist? On the fly, designing a research project, they gave you a scenario, and you had to define, the independent, dependent, the controls, the confounding factors. Like they were really testing, okay, yeah, you love research. Okay, great. Can you actually do it on the fly? Do you understand what you're talking about? They really, it was almost like kind of examining your psyche, because residency, much like dental school, it's rigorous, yes, but it also has a, you're pushing yourself to a new height. You're now a specialist, and you have to act like it. You have to talk like a specialist, walk like a specialist. And when there's a million things going on, you still have to keep your composure. So I think that they were trying to see, okay, it just felt like they were trying to get a feel of like childhood trauma kind of thing. And that, I was not expecting that. I was, you have the face on. And so when they start talking about like when you were growing up, what were some difficulties, or, they really wanted to get a whole glimpse of your story. So that was strange. Another same program, a different interviewer on Zoom asked me to share my screen and draw a circle the best that I could, and then solve for a particular angle using SOHCAHTOA on something else on a different grid that he had provided on his screen. It was just, again,
what?
I remember my SOHCAHTOA, I do, but I was caught so off guard that it was like, you just don't expect that at all.
Right. That's why I'm coming to the program, Dr. Smith, because I need to learn how that is. I don't know.
Yeah, exactly. So that was strange. But as far as the interviews in person, what helped me a lot for just prepping for the interview was going on externships. Now, who knows? There could be another pandemic, and that could prohibit students from going to those on-site visits. But in the meantime, I found that externships were very helpful, because, you pick out your outfit, and it's basically your interview day outfit as well. And, that day you're going to find out, were your shoes uncomfortable? It was, the pants just didn't fit right. You want to make sure that on interview day, you are confident, you are prepared. You don't need to be worrying about blisters from your new shoes. So I found that was helpful. But also, the residents and the faculty, they're going to be asking you more in-depth questions. So I was prepared on interview day, and I felt very prepared on all my interviews because I had already answered those questions. And on top of that, because you're on an externship, they're not afraid to ask you to keep probing further. And so, for example, I had one faculty member ask me, what type of patients do you want to see? I said, I want to see orthodontic cases because of my personal, experiences. And he said, well, those cases are rarely covered under insurance. And then, cases like that, like they can't afford those services on their own. They can't self-pay. So then what do you do? So he was asking me a question that I just didn't have an answer to. And he knew I didn't have an answer to it. But on interview day, I had an answer.
Yeah. And hopefully part of your answer was, well, it's required by CODA for the program. So I'm sure you all figure it out to make sure the residents and the oral surgery residents have those experiences.
Right. But basically saying, there's so many different components.
Yeah.
Do you know about them, Doc? Do you? Right. And I didn't.
Right.
But it's the best place to be learning them.
Yeah, and that's a great segue to being able to ask them those questions for your next interview, but also to gain and get that information about that program right then and there, because that will help you as you're taking your notes and eventually have to come up with your rank list. It'll help you decide whether or not this is the program that you want to be a part of, right?
Yeah.
Having those questions answered helps a lot. So answering those questions and you having questions for them leads you to the next step, which is, all right, I got all my interviews done, and now I got to go back. I got to go through my notes and I got to put these 17, 6 programs, 5, whatever programs together in order, right? 1 through 5, 1 through 6, 1 through 10, whatever it is. So let's talk a little bit about that process, because I'm sure, and this happens every year, every program, whether it's specialty, GPR, whatever, that what you started off with as far as your top program and your fifth program, probably during the process of your interviews, probably changed. 5 might have gone to 2, 2 might have gone to 1, 1 might have gone to 3. Talk a little bit about how you put together your rank list.
Yeah. I think first and foremost, like you said it best, my number one ended up being my last one. And with that in mind, be careful when you're sending out those thank you emails, because if you say I had such a positive experience, you're not allowed to say, I'm ranking you number one. You're not. Don't say that. But I had such a positive experience. I want to rank you highly. There's certain verbiage that Google was really helpful with finding what's okay to say. But that program was not a top choice for me. And you're at that point, I'm embarrassed and, felt like I lied. I felt like I cheated myself out of the program that I really did want to send that to and share that with. But a big, again, location, that was a big thing for me. Where would I end up? And I was moving with my boyfriend. And so what's a place where we can both feel like we could call home? A big thing was also having a program near a hotspot airport. So of course, flying in and out of New York City is a lot easier once you're actually at the airport than it is versus like some other cities in the country. So that was a big thing. And then the cost of the program. I think, once I start talking to people who are really interested in the process, they think, oh, you're in New York City, so glamorous and great. I'm like, well, yeah, but there are sacrifices involved with that. My program is paid, but the alternative is, you could end up at a different program where you're paying anywhere between $80,000 to $130,000 a year for 3 years.
I know that. Yeah. I know that. That is the largest ortho program in the country where you are paying them. Yep. And it's like dental school payment all over again.
Right. And then, you start thinking, okay, well, this is how old I am now. Eventually I want a house and a driveway to park my car in, for crying out loud.
I want a bed to sleep in.
I would love a bed, some food in the fridge. And so that's hard to swallow. And, people make comments, well, you must not want to be an orthodontist that bad. Sure. But it's a selfless thing. You're thinking about other people in your tribe and your support system.
Right.
So that was definitely a factor. And then life in that area. How did the residents make me feel? Did I feel welcomed by them? Were they rude? Were they pretentious? Were they incredibly intelligent? Did we have insightful conversation? That was hard because there are programs that I didn't list as my number one, but I loved the residents. I felt like I was letting them down, going to conferences, the AAO to going to Tweed, you'll see those residents again. It's nice to catch back up, and you're going towards the same goal. You're on the same team. And so it's nice to make those relationships on the interview trail, both with applicants and residents, because you will see them again.
Yeah. And you bring up a very important point, which is, your list and your program order will change over the process. And the fact that you said your one was not number one after your interviews is a testimony to that. But it's also important to highlight what you said, which is, only what's going to be the best program for you. And even though you may like the residents, it's also important that you have to like the program, because you're going to be there for 2 or 3 years.
Yeah.
And that's key. So, at the end of the day, it does have to come out. It has to come out the way that's going to work best for you.
Yeah.
First and foremost, right? So I think if people have been listening all the way through, which I think you guys have, but in case you didn't, we're going to now reveal where Dr. Christina matched. Where she matched. So after all that hard work, research, putting your application together, traveling virtually for your interviews, doing some externships, listening and telling programs why you share with us where you have taken your ortho talents to for your ortho program?
Yeah. So I'm at Bronx Care, housed in the Bronx. There you go. So it's nice where we'll hop in on Zoom calls with St. Joseph, and once a month for craniofacial conferences to kind of diversify even more the type of patients that we see. It is a hospital-based program, so with that in mind, I knew, okay, self-paced will be the type of the learning modem here, but that is just, like I said, a very steep learning curve. Advice for anyone applying, if you match, start reading Profit. Just start reading Profit. You don't have to understand it all. Right. No one expects you to, but at least to start getting their vocab, the verbiage, in your system, so it's not so foreign.
Profit. You guys, you if you don't if you don't remember it, or if you haven't gotten to it, or you forgot, if you're applying to ortho, you need to go back to it ASAP, and that's a great segue for tips. Knowing what you know now in this whole process, in addition to you just gave us one great tip, which is once you get into ortho, get into a program, or even in preparation for your interviews, knowing some of those angles that are in the Profit book.
Wouldn't have been the worst idea.
Right.
It would have been nice.
Depending on what program you go, you get interviews from. Someone may just be clever enough to ask you one of those questions. You're like, huh? Yeah. I can spell Profit, but I don't know everything that's in the book. But anyway, tips and advice for those applicants that are going through this process right now. What would you say?
So every program will ask you at some point, and even you can put in your personal statement, they're going to ask you why this program. And a lot of students were saying, myself included, I'm interested in this program because of the population living in the area. I'm Hispanic. I believe that there's a need to close that gap as far as the language barrier, and I'm able to do so. And that's an important thing for me to continue doing in my ortho residency. Another thing was complex cases. I want to see everything under the sun. And their response to that was very straightforward. It was, okay, well, you're going to get that at any program. So what else are you looking for? So my advice would be to not say either of those answers, and to also develop your own answer, to really customize it to what you really are looking for. Walk away from your computer, give yourself some time to reflect, because you do have an answer, and it doesn't have to be a cookie cutter answer, because I promise you, when you start speaking from what you actually feel, like this city, I was here in the city a few months ago, and I was walking down the streets, and I just felt like this was a place I could call home. That's an example of something that they're like, oh, this person has really given thought to what life would be like while they're here. Another thing was they really wanted students willing to go above and beyond to advocate on behalf of the orthodontic profession. Everybody knows that there's a million different Facebook ads and all this non-orthodontic resident sort of appliances that people can mail in for. And I don't think in dental school, or people just not in the dental profession at all, I don't think that they're educated on making the right decisions for their own oral health. So I think that there's definitely a need for orthodontists to step in and start advocating, working down the pipeline. And that's something that we talked about a lot during interviews. And also, lastly, with leadership roles, I know that that's not for everybody, but I know, as the SNDA, again, not everybody is interested in something like that, but there are modems to pursue some sort of route in advocacy. For example, states like New York, North Carolina, Nevada, they love when dental students want to attend the dental association meetings. They love bringing students in. Hey, have a seat at the table. That's their thing. And so those are the Colorado even as well. So why not chime in? Yeah.
Yeah, those are great. Yeah, those are important. And every program is going to be different, but it will reflect upon you as a candidate as to how how are you going to advocate, and what are you going to bring to our specialty, to our profession, because you will have to contribute. That's part of your duty, your responsibility, and your obligation as a board certified orthodontist to make contributions to the ortho specialty as well. Man, these have been some good stuff. I hope you guys stayed all the way through, because Dr. Christina was dropping some gems here. Doc, what's the best way to get in contact with you if people have questions, or if they just want to connect with you?
Yeah, of course. I'm happy to do so. I'm happy to connect. My Instagram is Christina, Christina. Then my last name, Aponte. So no spaces, no hyphens. Feel free to, at any time, just send me a message with any questions. I'm happy to help out in any way that I can. And I'm excited. I'm excited for the future of the orthodontic profession. Awesome.
Well, we're excited that you're excited and that you are having a good time your first month in ortho. And definitely what you shared today has been very helpful for many people. So thank you so much, guys. Hopefully these episodes and these videos here will be helpful as well. And guess what? That's our time. Love, peace, and smiles. We'll see you on the next video. See you next week. Thanks, Doc.
Thank you.